The influence and effectiveness of Section 2, subsection 2A, B, C, D, and E of the Health and Safety at Work Act 1974 on organizational health and safety performance. The Health and Safety at Work Act 1974, or HSWA, stands as a cornerstone in governing workplace health and safety in the United Kingdom, as noted by Smith in 2015. Enacted in 1974, this legislation provides the legal framework for occupational health and safety regulations in Great Britain, aiming to prevent deaths, injuries, and illnesses arising from work activities, as highlighted by Hughes and Ferrett in 2016. Section 2 of the HSWA outlines the general duties that employers have towards their employees. Specifically, Section 2, subsection 2 elaborates on the key areas falling within the scope of the employer's duty of care. This includes the provision of safe equipment, safe handling and use of substances, information and training, maintenance of safe premises, and a safe working environment as stated within the Health and Safety at Work Act 1974. This article provides a critical review assessing the influence and effectiveness of Section 2, subsection 2, A, B, C, D, and E of the HSWA on organizational health and safety performance in the UK. It analyzes the legal provisions, compares implementation across sectors, and evaluates the impact on improving workplace safety outcomes. Thus, the Health and Safety at Work Act 1974, particularly Section 2, subsection 2, plays a vital role in shaping and safeguarding the health and safety landscape in the UK workplace. Legal Provisions Analysis. Section 2, subsection 2A, Safe Plans and Systems of Work. Section 2, subsection 2A of the Health and Safety at Work Act 1974 legally mandates employers to ensure that equipment and systems used for work are designed, maintained, and operated safely as far as reasonably practicable, as noted by Hughes and Ferrett in 2016. This provision encompasses machinery, appliances, apparatus, tools, production lines, transport equipment, and other facilities, as outlined by Ridley in 2016. Employers are obligated to identify hazards associated with plants and equipment through risk assessments, take steps to eliminate or reduce risk, and provide information and training to employees, as highlighted by Hughes and Ferrett in 2016 and the Health and Safety Executive in 2018. This provision is vital for managing one of the most common sources of injuries, dangerous equipment and production processes. It places the responsibility firmly on employers to proactively identify and control risks, going beyond just reacting when things go wrong. According to the Health and Safety Executive in 2020, plant and machinery accidents accounted for 150 fatal injuries at work in 2019 and 2020. Section 2, subsection 2A provides the impetus for investing in inherently safe design, maintenance regimes, and safe systems of work, as noted by the HSE in 2018. Thus, Section 2, subsection 2A serves as a crucial pillar in ensuring workplace safety, urging employers to prioritize proactive measures to safeguard their employees. Safe handling, use, storage, and transport of substances. Section 2, subsection 2B of the Health and Safety at Work Act 1974 mandates employers to establish robust arrangements for mitigating risks associated with hazardous substances used at work, as highlighted by the Health and Safety Executive in 2018. This requirement extends to various hazardous substances, including chemicals, dusts, fumes, and biological agents, as noted by Hughes and Ferrett in 2016. Employers are tasked with implementing safe handling practices, ensuring appropriate storage facilities, controlling hazards during transportation, and providing safety information such as labeling and safety data sheets. Exposure to hazardous substances is closely linked to occupational diseases, with an estimated 8,000 deaths annually in Britain attributed to past exposures at work, according to the Health and Safety Executive in 2020. Thus, Section 2, subsection 2b serves as a pivotal measure in ensuring the safety and well-being of employees by addressing the risks associated with hazardous substances in the workplace. Section 2, subsection 2c, information, instruction, training, and supervision. This provision mandates employers to provide adequate safety information, instruction, training, and supervision to employees to ensure their health and safety at work, as noted by Smith in 2015 and outlined within the Health and Safety at Work Act 1974. It encompasses various aspects, including initial induction, job and task-specific training, and ongoing supervision. Lack of training is identified as a major factor in occupational accidents and ill health, according to the Health and Safety Executive in 2018. This requirement pressures employers to implement training needs analysis, develop comprehensive training plans, establish suitable delivery methods, and implement monitoring arrangements to ensure the workforce is competent to carry out their work safely, as highlighted by Hughes and Ferrett. According to the Health and Safety Executive in 2020, 26% of 2019/2020 fatal injuries were linked to inadequate training. Section 2, subsection 2c drives organizational investment in safety, education, and leadership. Thus, Section 2, subsection 2c underscores the critical importance of comprehensive safety education and leadership in ensuring the well-being of employees and reducing workplace accidents and fatalities. Section 2, subsection 2d, safe work premises and access. Employers are obligated to maintain places of work under their control in a condition that is safe and without risks to health. Section 2, subsection 2d of the Health and Safety at Work Act 1974 also mandates the provision of safe means of entry and exit, such as doors, passageways, stairs, and ramps, enabling safe access and egress, as emphasized by Hughes and Ferrett in 2016. This subsection ensures that the work environment itself does not pose unnecessary risks to employees through inherent design flaws or inadequate upkeep. Physical working conditions are closely linked to accidents, musculoskeletal disorders, and poor mental health, as highlighted by the Health and Safety Executive in 2018. Section 2, subsection 2d motivates the establishment of fit-for-purpose workplaces with ongoing maintenance programs and audits aiming to mitigate environment-related risks. Section 2, subsection 2e, safe working environment. The final provision of the Health and Safety at Work Act 1974 mandates employers to provide a working environment that is safe, without health risks, and adequate regarding employee facilities and welfare arrangements. It surpasses employers to consider both human factors and soft issues, such as job design, behavioral safety, and mental health support, alongside hard issues like engineering controls and personal protective equipment, as emphasized by the Health and Safety Executive in 2018. It provides a comprehensive legal framework guiding organizational safety activities and investments in a proactive direction focused on risk mitigation. Comparative analysis. The practical implementation of Section 2, subsection 2, health and safety responsibilities. High hazard sectors like construction, manufacturing, and mining/quarrying have developed extensive occupational safety management systems and controls to mitigate their disproportionately high risks under Section 2, subsection 2, according to the Health and Safety Executive in 2020. For instance, mandatory pre-use inspections of machinery, permits to work systems for confined space entry, industrial hygiene exposure monitoring programs, and compulsory annual refresher training on risk critical tasks are commonplace in these industries, as noted by Jackson et al. In 2013. Thus, understanding and addressing these variances is crucial for ensuring the effective and comprehensive fulfillment of Section 2, Subsection 2 duties across the spectrum of UK workplaces. Impact assessment. Since the introduction of Section 2, Subsection 2 as part of the Health and Safety at Work Act 1974, Great Britain has experienced significant improvements in workplace health and safety outcomes, as detailed in Health and Safety Statistics published annually by Health and Safety Executive. For example, the total number of reported non-fatal injuries has fallen from 2.9 million in 1981 and 1982 to 381,000 in 2019 and 2020. An impressive 87% drop, according to the HSE in 2020. The incidence rate of reported injuries relative to employees has seen an even greater decline of 94% over this period. Occupational disease statistics shows a similar downward trend, with annual deaths attributed to past exposures at work dropping from approximately 25,000 in 1974 to 8,000 today, as noted by the HSE in 2020. Britain's workplace fatality numbers have also fallen from a peak of 651 in 1974 to 111 in 2019 and 2020, an 83% decrease. These striking long-term improvements in safety metrics clearly illustrates the positive impact of the Health and Safety at Work Act regime established since 1974, within which Section 2, Subsection 2 provided the critical cornerstone. Research overwhelmingly attributes the Health and Safety at Work Act as the primary driver of increased risk awareness, management activity, compliance investment, and safety culture maturation across British workplaces over the past 5 decades, as noted by Baldock et al. In 2006, Davies and Wright in 2008, and Bradley et al. In 2013. Conclusion. In summary, this critical review has analyzed how the specific provisions under Section 2, Subsection 2A, B, C, D, and E of the Health and Safety at Work Act establish a comprehensive framework of health and safety responsibilities that employers are legally required to fulfill. These targeted duties aim to control key risks through inherently safe equipment, process, and workplace design, robust chemical handling and storage arrangements, adequate workforce information, training, competence, and supervision, properly maintained premises with safe access, and an adequate working environment and facilities. Continued adherence to the development of Section 2, Subsection 2, as part of a wider occupational health and safety management system remains vital for safeguarding employees from harm at work. Thus, the legacy of Section 2, Subsection 2 stands as a testament to the enduring commitment to workplace safety in Great Britain, ensuring a safer and healthier environment for all workers. For this group assignment, the following contributors have played essential roles in its development: Omawumi Orekoya, Dylan Joseph, Chirag Kumar Kalaria, Generous Ugwadu, Folukemi Roslyn Falade, together with their collective efforts, have contributed to the comprehensive analysis and presentation of the subject matter. We extend our gratitude to each member for their dedication and collaboration in producing this assignment. I am Geoffrey Izuchukwu Oro.